Hello and welcome to another Alzheimer's Society of Calgary Facebook video talk. I'm Paul Bartel, the Manager of Learning and Support Services, and joining me today is Dr. Dilpriya Mangat, a gerontologist. Thanks for coming.
Thank you for having me.
Yeah, today we wanted to talk a bit about medications, and specifically those medications that can be used for managing the symptoms of dementia. So, Dilpriya, could you tell us a bit about what are the medications that are used?
Typically, we're still using 4 common medications to treat, symptomatically treat Alzheimer's type dementia. The 4 medications are Aricept, that's the trade name for donepezil. In addition, rivastigmine, galantamine, and the 4th medication is memantine.
Okay, and you said they're used to treat Alzheimer's disease,
Yes.
so they're not necessarily used for all forms of dementia.
Well, they're approved in Canada specifically for Alzheimer's type dementia. They have been studied in other dementias such as Parkinson's disease dementia, dementia of Lewy body, vascular dementia, but they're not yet approved for those medications. But you can consider, your physician and you can talk and consider trialing, seeing if there's a symptomatic improvement for those conditions of these medications.
Okay. When might these be used? Like, do you start them right away or different times?
Good question. So typically we consider these medications when you're formally diagnosed with Alzheimer's type dementia. There's conditions such as mild cognitive impairment, which we can talk about. And then we look at the stage of your dementia. We typically categorize dementia as mild dementia, moderate dementia, and then severe dementia. In terms of Alzheimer's disease, donepezil, rivastigmine, galantamine, these are cholinesterase inhibitors. You can use them in mild, moderate, and severe dementia. Memantine, however, has been approved for moderate to severe dementia. So the stages do affect when you can be on the medication.
Okay. And you talked a bit about their cholinesterase inhibitors.
Yeah.
So how do these work?
So somewhat complicated, but we can talk about first the cholinesterase inhibitors. These are your donepezil, rivastigmine, and galantamine. Cholinesterase is there's an enzyme in your brain that breaks down a particular neurotransmitter called acetylcholine. Acetylcholine has a lot of functions, but in the brain in particular locations, having good levels of this chemical or neurotransmitter can affect your cognition, your attention, your behavior, your mood, and your ability to function. So we think that people with Alzheimer's dementia, or in theory we found in studies, have a lower level of this chemical called acetylcholine. By giving people these 3 medications, we inhibit that enzyme that breaks down acetylcholine. Therefore, you have higher levels of acetylcholine. Therefore, you have a better brain that functions better in Alzheimer's dementia. Memantine works differently. Memantine works on a receptor. It's called N-methyl D-aspartate. So to short form that, it's called NMDA receptor. And when this receptor is overactive, it's actually in a way excitotoxic to the brain, meaning in particular areas of the brain when this receptor is overactive, you have impairments in your attention and cognition, and it's commonly overactive in people with Alzheimer's dementia. By taking memantine, it comes and decreases the excitotoxicity of these receptors, or the overactivity of these receptors, in theory, in studies, improving then cognition and behavior and functioning.
And I know I've read that sometimes memantine is given in conjunction with one of the other ones.
Yeah. So it's really, that's a great question, Paul. Actually, a great comment. In some studies, they found that people who took both, let's say donepezil and memantine together, actually had a little bit more improvement in their cognition, their functioning, and so forth. So when people are in the moderate stage, they can have memantine potentially added on to their donepezil or rivastigmine or galantamine if they're already on it, and then you can have some additional benefit.
Great. Okay. So looking at the benefits, what are the possible benefits of being on these medications?
So all 4 show the same kind of benefits in the study, and they're marginal benefits. They're not overwhelmingly obvious. Most common, first and foremost, is cognition. And in cognition, we see the benefit particularly in attention and in some memory recall. We also have seen benefit in behaviors, and specifically the type of behaviors are apathy or lack of motivation, in behaviors of agitation and sometimes aggression marginally, and then in some cases hallucinations, delusions have improved with these medications, not dramatically or drastically, but enough that caregivers and patients have noticed some improvement in studies.
Okay. And I think it's probably important to note that these are all, they manage symptoms. They don't affect the underlying condition or what's happening in the brain.
That's right. And another benefit actually I didn't mention is functioning. So there have been improvements in studies in people's ability to function. So we look at functioning as higher order functioning, managing your finances, your grocery list, and then your day-to-day functioning of self-grooming, hygiene, and so on. So there has been some improvement in that. But again, that's why we say that for the symptomatic treatment of dementia, by no means are they a cure, that they will reverse it.
Okay. And with any medication, there are side effects.
Yes.
So what are some of the potential side effects of these medications?
Right. So rivastigmine, galantamine, and donepezil, they are in the same class of medications, and so they typically have very similar side effects. Most people, typically 1 in 10, may experience within starting the medication or an increase in dosage, the common symptoms of nausea, vomiting, diarrhea. Rare, but some people can experience on these 3 medications. In addition to that, they can experience side effects of vivid dreams, bad nightmares, insomnia. They can have weight loss, dramatic weight loss, such as anorexia. So yeah.
Okay. So that then leads me to I always wonder, when do you not want to use these? I guess the technical term is probably, what are the contraindications?
Contraindications. Another side effect I didn't mention was memantine. So common side effects of memantine actually are headaches and constipation and dizziness for some people. And even with donepezil, rivastigmine, galantamine, people can experience dizziness at times. But the contraindications to both types of medication, memantine and the 3 other cholinesterase inhibitors, is if you have any allergy or you're hypersensitive to any of the formulation of the medication itself. And obviously you cannot be in the medication at all. Relative contraindications, or most certainly patients with these conditions should be cautiously considered or not considered at all, are those patients who have particular heart conditions, so bradycardia, low heart rate, particular heart blocks such as first or second or absolutely third degree conduction blocks, and left bundle branch blocks. Your family doctor would know what these conditions are.
Good, because I'm at sea.
Yeah, lots of complicated terms, I know. And then anybody who has a seizure history should not be considered for these medications. If you recently had a stomach bleed, what we call a gastrointestinal bleed or a peptic ulcer disease that's active, you should not be on these medications. Those are the absolute contraindications for donepezil, rivastigmine, and galantamine. Patients who should be considered cautiously and monitored cautiously on these medications, if they are to be begun on them, are patients who have asthma and COPD, or have had a history of peptic ulcer disease, or poor renal function. They should be cautiously monitored, and that's a discussion between you and your physician if you even want to try the medication. In terms of memantine, again, if you have a hypersensitivity to any formulation of that drug, you should not be on the medication. And then in some cases, if you have a seizure history, you should not be on memantine. If you have poor renal function, you should not be on memantine. It's a little bit more well tolerated than donepezil and rivastigmine and galantamine are.
Okay, great. So, and I'm just going to circle back to something we touched on and then left, and that's the question of mild cognitive impairment. And do any of these medications, would they be considered for somebody with an MCI or not?
Right. So first and foremost, these medications should be considered if you have Alzheimer's, dementia. And mild cognitive impairment can seem confusing because the term itself but that means you do not have dementia.
Right.
It means in a simple term, you could consider you almost have a pre-dementia, or you're showing some early symptoms, but they have not affected your functioning as yet, therefore you do not have dementia. And thus, you should not be on these medications because you do not have dementia. And they have studied them in patients with mild cognitive impairment, and they found very little benefit, and most of these patients were the side effects.
Okay.
So these are not medications to be considered.
Great, thank you. I know that'll be a question some people might have. So we talked a lot about when you might start, why you might not start. What about if you get on these and decide they're not for me, or when do you have that discussion about maybe it's time to stop taking this?
That's a brilliant question. So there are some conditions where, or times where you should consider or think about discontinuing these medications, always in discussion with your family physician and obviously your family and caregivers. Versus if you as a patient decide, I don't want to be on this medication, or your caregiver feels this medication is not
working.
Yeah, for my loved one, then you absolutely can discontinue the medication. If the side effects are intolerable, you should not be on the medication. If you begin the medication and you're monitored for a few months, typically at least 6 months, and there's very little stabilization or improvement or efficacy, you don't need to continue taking the medication. We also evaluate when you're really approaching the end stage of your illness. You're no longer verbal, you're bedbound. Now we should evaluate, is there any utility in these medications?
And coming off them, are there any, because these are obviously fairly powerful medications that affect the brain, and would there be any side effects or things that might show up as a person is withdrawing from them?
So rarely when somebody is discontinuing the medication, when they're in their severe stages, there can be a slight further deterioration on the medication, which is why you always should stop your medication in conjunction with whoever is managing your dementia, be it your family doctor or your geriatrician. There's always a risk that they may further deteriorate when they're off the medication. And absolutely, as all medications, any medication that works on the brain, abruptly discontinuing it can cause withdrawal symptoms, the worsening of your symptoms such as confusion and so forth. These medications are not mild, as you just mentioned. They should be taken as prescribed. They should be adhered to. You cannot take them one day and not take them for a week, and take them one day and not take them for a week. You should adhere to them as they're prescribed, because taking them inconsistently can lead to further deterioration.
Okay, great. Thank you so much for spending some time with us to talk about this issue. And thanks everyone for joining us today. If you have questions on this topic or any other topic, you can feel free to reach out to us at either 403-290-0110, or you can email us at findsupport@alzheimercalgary.ca. We'll be back in 2 weeks with another video. If you have questions on a topic you think we should address in one of these, please let us know with a comment below, or send us an email at the address I mentioned, and we'll try to address them as soon as possible. Thanks so much.